This is Atrial Rhythms, part 2 of 4. A single electrical impulse that originates outside the SA node in the atria is an atrial generated rhythm. This can occur in the atria, the AV junction, or in the ventricles. The premature beat is a complex that arises earlier than the next expected beat. The word contraction commonly used to describe premature beats. All complexes represent only electrical activity of the heart. Complexes do not show mechanical activity, and that's important. We can only assess that by checking a pulse. An incomplete or non-compensatory pause often follows a PAC, or a premature atrial contraction. It does look like the normal underlying rhythm complex. The underlying rhythm is interrupted due to the PAC. After the non-compensatory pause, the underlying rhythm of the heart returns and continues until the next PAC occurs. If two sequential PACs occur, those are called bigeminy. Every other beat is a PAC, and that's known as trigeminy. It's important to remember that premature atrial complexes look much like the normal complexes of the underlying rhythm. Some of these causes include use of stimulants, such as caffeine, alcohol, energy drinks, hypoxia, increased sympathetic tone, imbalances of electrolytes, and digitalis toxicity. When any premature beat occurs more than 6 times per minute, it is termed as frequent. So going step by step, we look at the rate. The rate is usually normal, within normal range. The rhythm is regular with the exception for the PAC. In checking, is there a P wave before each QRS, and are the P waves upright and uniform? The P waves typically differ in shape, size, and location from the normal P wave. This is only for the PAC. The underlying rhythm P waves remain the same. The PR interval could be variable depending upon the pacemaker site. And all the QRSs look alike. They are generally small or narrow, less than 0.12 seconds, or 3 small squares. So let's take a look at this premature atrial complex and let's decipher it. If you look at the rate is 70. The rhythm is irregular, as we can see. There are P waves, and they are present, upright, and rounded. The PR interval is 0.16 seconds in length, and the QRS complexes are 0.06 seconds in width. We can see that if we were to plot everything out here, it's regular with the exception of this complex right here. And this complex is early, and as you can see, we have that compensatory pause afterwards that basically allows it to reload, and then we start back with the regular underlying rhythm. When you see this one, it is going to be a PAC. With atrial flutter, you have the presence of regular atrial activity with a picket fence or a sawtooth pattern. A single irritable site in the atria initiates many electrical impulses at a rapid rate. Normal P waves are not produced. Instead, large F or capital F waves are produced for flutter waves. Electrical impulses conducted through the atria at a fast rate. Rather than the presence of normally appearing P waves, as I stated, flutter or sawtooth waves known as F waves are patterned. The AV node becomes the gatekeeper to the ventricles. Based on the number of impulses that the AV node accepts, ventricular response will be established. So in other words, if you see 2 atrial contractions for every ventricular contraction, we call that a 2-to-1 conduction rate. If there are 4 atrial contractions for every ventricular contraction, we call that a 4-to-1 conduction rate. An atrial rate of 300 beats per minute will parallel with a ventricular rate of about 75 beats per minute. An atrial flutter with a slow ventricular response will result in a ventricular rate of less than 60 beats per minute. An atrial flutter with a rapid ventricular response will respond with a ventricular rate of 100 to 150 beats per minute. Going through our step-by-step, we want to look at the rate. Keep in mind that the atrial rate and the ventricular rate are going to be different. The atrial rate could be as much as 250 to 300 beats per minute. The ventricular rate is going to be variable depending upon which impulse gets through. The rhythm, the atrial rhythm, is going to be regular because it's the same primary spot that is firing, but it's just not the SA note. The ventricular rhythm could be regular or irregular. When we look for P waves before each QRS, and are the P waves upright and uniform, we see that normal upright and rounded P waves are absent. These are replaced by capital F waves that look kind of like the teeth of a saw. Because we don't have any P waves, we are not able to measure a PR interval. As far as your QRS complexes, they generally all look alike, and they are narrow, coming in 0.12 seconds or less. So let's take a look at these two rhythms. These are two entirely different rhythms, and let's go through each one of them. So at the top strip, the rate is going to be 80, and we can see that the rhythm is fairly regular. P waves have been replaced by F waves, and that's these waves right here. As you look, they kind of look like a sawtooth, right? There is no PR interval because there are no P waves. Been replaced by capital F or flutter waves. The QRS complex is 0.04 seconds. The rhythm is then called atrial flutter with a 3-to-1 conduction. Why is that? Because we see 3 F waves and then our QRS. We see 1, 2, 3, and then a QRS. 1, 2, 3, and then our QRS. So let's take a look at this one down here. The rate is 100. The rhythm is regular, and obviously we have F waves, capital F or flutter waves. And because we have flutter waves, we don't have any PR interval. The QRS complex is 0.04 seconds. Therefore, we look at this and we can see that we have flutter waves, flutter waves, flutter waves here, and this would be atrial flutter with a 2-to-1 conduction, which means this impulse is firing twice, one of them's getting through, versus up here the impulse is firing 3 times and one of them is getting through, and that is your atrial flutter. Closely related to atrial flutter is atrial fibrillation. Atrial fibrillation is one of the most common atrial dysrhythmias. It presents with 3 definite characteristics. Notable absence of P waves. Instead, P waves may be replaced by small F or fibrillation waves. Ventricular response is totally irregular or termed irregularly irregular or grossly irregular. The QRS complexes are usually within normal limits, and because we have multiple ectopic foci from within the atria that are blitzing the AV node, it is very irregular. The AV node is unable to handle or conduct each impulse. Therefore, that's also what helps to make it irregular. The AV node allows some of these impulses to enter the conduction system at random, which leads even more so into the irregularity.
Atrial fibrillation, or AF, is an irregular heartbeat. It is caused by a breakdown in the natural pacemaker that is responsible for making sure that the 4 chambers of the heart contract in a coordinated way to pump blood around the body. Under normal circumstances, the pacemaker first makes the 2 chambers at the top of the heart, called atria, contract, squeezing blood into the 2 lower chambers, also known as ventricles. These in turn are triggered to contract, pushing blood out of the heart, into the arteries, and out to the body and the lungs. In AF, a malfunction of the pacemaker interrupts this coordinated sequence of contractions, causing the atria to twitch erratically, known as fibrillation, and the ventricles to contract more often and irregularly.
So as we go through our chart, we compare the rate. Once again, much like we saw in atrial flutter, our atrial rate and our ventricular rate are going to vary. The atrial rate, if you were to count it, could be as high as 400 beats per minute. The ventricular rate will be variable depending upon which impulse gets through. The rhythm is grossly irregular. And keep in mind, when we are looking at P waves, normal P waves are either just not there and we have kind of like a squiggly line where P waves would be, or it could be completely flat and we wouldn't see anything at all. As far as the length of the PR interval, there is no PR interval because there are no P waves. The QRS complexes generally all look alike, and they're going to be less than 0.1 seconds. This rhythm may be chronic in nature, commonly associated with underlying heart disease, congestive heart failure, or rheumatic heart disease. Hypoxia, acute MI, digitalis toxicity, as well as electrolyte imbalances can cause this. As far as the treatment, if it's a slow heart rate or a rapid heart rate, we want to speed it up or slow it down. One of the common drugs that is used as far as treating this is digitalis. So let's take a look at our rhythm here. The heart rate is 90 as you're looking through. You can see that the rhythm is grossly irregular. You don't even really have to look at that to measure it out. If you wanted to, you could take a piece of paper and put one edge on one QRS and make a hash mark over here and then kind of walk your QRSs out, and you'll see it's very irregular. P waves have been replaced by fibrillation waves. Now these are different than flutter waves in the fact that they don't look alike. So this kind of looks like ventricular fibrillation only in the atria. So make sure that you don't get that confused with ventricular fibrillation. Because of this, there is no PR interval because there's no P waves. As we measure out the QRS is 0.0 seconds. And therefore, as we see how grossly irregular it is, there are no P waves, this has to be atrial fibrillation. This concludes part 2 of 4 of understanding the atrial arrhythmias.